There you go. Okay. I edited a recent show brilliantly. I got everything put together through Audacity, so I am waiting for this to, it says it's validating credentials and connecting to the server and all sorts of stuff. Yes, thank God. I don't think I need the tutorial because it says it is indeed recording. So, but this is what I hate. No, I don't want to leave the meeting. I don't know why I've got this up here too. Anyway, so, okay. I trust things have been well otherwise?
Yeah, things have been fine. Knock on wood. How are things for you?
Aside from dripping wet, thank God nothing is flooding in here, but it's fine. It's great.
Good.
So, all right. So, naturally, just as I say I'm about to start, the cough comes. All right. Well, at least I can edit stuff, so we shouldn't have a problem. Okay. So here we go. Good morning again, folks, and thanks for joining in to Blog Talk Radio's and speakers. Oh, see, I'm sorry. Got to start again. I'm glad I can edit that out. All right. Hello, folks. Thanks for joining in, Partners in Health and Business. This is Wendy Myeroff, the biz anchor of the show, and I'm welcoming Jennifer Dyer of Jennifer Dyer Graphic Design, based in Baltimore, Maryland. Jennifer has over 30 years of experience crafting effective communication for human services, grant makers, and education. She works both in print and digital media, serving organizations around the country, even though she's based here in my Baltimore area. Her clients have included Baltimore Community Foundation, Baltimore Metropolitan Council, Grassroots Grant Makers, Johns Hopkins Bloomberg School of Public Health, and there's more, folks, and I could keep reading, but we'll give you Jennifer's website in a little bit, and you can check out more online. So thanks again for joining me, Jenny, as I understand you don't mind being called.
Not at all. Thank you so much, Wendy, and whatever, Jenny, Jennifer, either's fine.
As long as they put it correctly on the paycheck, right?
That's true.
That's what we always say. And I have trouble with Meyer-Hoff down here in the Maryland area because there's a very famous Meyer-Hoff family. So, as I say, as long as they get it correct on the paycheck. So anyway, so here you are, the graphic designer, and you're zooming along, and the web comes along. And so you managed to start including web work, right?
Yeah. Mm-hmm.
And so if you're working with a nonprofit, and I understand that's a big group of what you do, why wouldn't they just have their own web designer? Why do they come looking for you?
Well, people come to me because I offer custom websites, and everything is completely customized to the client's brand, to their audience. So that's really why people come to me. I have a lot of experience working with nonprofits and primarily with philanthropies and human services as well as schools. And it makes a difference, I think, to work with someone who understands what your priorities are and what you do. So that's really what I offer, A lot of times, yes, go ahead, sorry.
No, a lot of times what?
Mm-hmm. Well, people will try to do things themselves to start off with, and it can work out just fine to do something, like to get yourself established, like on the web. But ultimately, there comes a point where people really would benefit from professional help with that type of project.
Right. And so how did you convince them, or how did you move, let's say, from print design to actual web work? I mean, did somebody just say one day, well, look, we've got to set up a website, or did you go back to school? How did this come about?
Well, I did go to school. Well, it wasn't specifically for digital media, but I have a master's in publications design, integrating print and writing and design for an audience, and part of that was doing digital media. So I did have some training in it, but things are constantly changing. So at the time, the web was really rudimentary, and really it was just about creating hyperlinks and helping people get around without getting lost, but I had a client I did a ton of work with who wanted to have their first website, and I helped them do that. It was a huge undertaking. It started off not that big, but as with, so many projects like that, where you don't commit to a print piece at the end, it's something that just grows over time. So, we worked together. They knew me and trusted me to do the work for them, and it worked out really well.
It's funny because I remember my husband was a leader of the New York Mac Users Group back in New York, and I was their PR director, and I was one of the main non-techies zooming around. Everybody else either had a computer background, they loved computers. I wanted to be the writer, so that's what I was doing. And one day, Richard's home, and he says, "Oh, by the way, they're having a web class, and this is in like the early 90s or something." And he says, "You really ought to go in and find out about it." And I said, "I don't want to be the designer. I'm the content writer." No, it's good if you go learn. So I said, "Okay, I will go in." In New York, I hopped on the subway. I didn't have to get stuck in traffic forever. So I go in, and I get to the meeting, and I think I spent 5, maybe 10 minutes in class, come back home very early. He says, "What are you doing here?" And I say, "Of course, I live here." And he says, No. What happened? I said, "They're doing coding. It's codes for what I learned as a proofreader, where it's cut this paragraph and, make the headline bold." And I said, "No, I ain't doing this." So God bless those of you who were doing it early on. I did the content for early websites like the American Medical Associations and Janssen Pharmaceutica and many others, but I did not want to do the coding. So God bless graphic designers and web people. Thank you so much. But this always brings us, when we're talking nonprofits especially, and here we are on Partners in Health and Biz, and we're talking not only to nonprofits, but anybody who's doing healthcare-oriented websites. So, but if they're a small company, whether they're a small medical practice or a nonprofit or whatever, why couldn't they just hire a college grad? Or I see all these ads, they're not even really paying somebody, they're using an intern for the summer, and it's going to cost them little or no real salary. People are building their portfolio, so why shouldn't they just go out and do that?
Well, the biggest problem, I think, is that you really need somebody who understands you to design your website. Even if you did it yourself, that would be better than having someone who's just there for a few months in the summertime. The key thing is, if you're doing it yourself, are you using your resources in the best way possible? And that, if your forte is fundraising, then you should be out fundraising. But, that's one of those things that you really have to balance. Priority should be, you need to have a website. Everybody really needs to have a website. But once you have that,
especially nowadays, we started maybe in the 90s, even at the beginning of the 21st century, there were places you could get away with it. And in fact, I just am finishing an ebook called Web 1.0 for the Editorial Freelancers Association that's due out, and I even interviewed you, or used part of your own website, which is great design. It's quick, it's easy, but it's beautiful. And so I was writing Web 1.0, and a lot of people in the editorial writing type of fields they think it's just a matter of reputation, and maybe if they post to LinkedIn or places like that, they'll get business. And in the 21st century, especially now, here we are almost 20 years into the 21st century, you really need a website, right?
Yeah, you do. I mean, it's as essential as a business card, maybe more so, because there's so much interaction that happens, not physical interaction that happens. So, and when people hear your name, first thing they do is Google you. They're looking for your website, and it's a little bit of a bummer if it's just, a white pages link, or something that seems peripheral.
Or Yelp or something like that. If you're a dietitian and you're building great food samples or something like that, and you just put a Yelp in menus, or Lord knows what people think of will work. Even nice places like Instagram and Pinterest, where maybe you can post interesting recipes, let's say if you're starting your first cookbook as a dietitian and so forth. That there are certain things in social media, which we can get to in a minute, that can give you great response. But as you just said, now if they want more information, where are they supposed to look for it if you don't have a website?
Yeah.
Or if you have a website that doesn't look too good, that doesn't really help, right?
Yeah, and if it doesn't work well, because that can drive people nuts. You go to a site and it's broken, the links aren't working, or the pictures aren't showing up. There's one website I went to. I've been going to it because it offers some information about a project I'm working on, but it's got an animation that runs across the bottom of the screen nonstop. And I'm like, I can't read while there's all this distracting motion going on. So I actually edit the web page in the browser to delete it so that it's not there. And I think they're thinking, hey, I might click on that and get their little PDF download, but instead I'm like, make it go away if I'm going to have to stay here. But I think that, people don't spend a lot of time. They spend a few seconds on your page. If they happen by chance to find what they want, then they might go and look some more. But, chances are really good that they'll just go and leave. So you really don't want to turn people off, and you want to tell them who you are and why they should be there, fast.
Yeah. It's very funny because I have on my list of questions coming up later, but I'll bring it up now because it truly affects people. And I'm going to take a short break that I can edit out because the fire alarm is going by. Okay. Come on, fellas. Are you going or coming? All right. No, I had an incident a few years ago. I was online. There's a guy who's made a fortune telling people how to make a living as writers and that kind of thing. And he does good stuff, really. So he had a monthly email newsletter, and one of his tips was, you really got to click onto this website. It's so amazing. You have to see what this guy is doing. So, all right, and I'd already seen answers. Oh, this is great. This looks wonderful. Boy, I need something like this. Well, there's a thing called Flash, which you probably know even better than I do. And it got really popular, and things would burst at you and so forth. And I go in and I look at this guy's site, and the first thing that hits you, literally, is this lion roaring and screaming at you, and it even looks a little like the MGM lion opening. Mm-hmm. And if I wasn't there to truly examine the site, I would have clicked off. And they used to say we have 10 seconds to attract and keep somebody's attention, and now we're down to nanoseconds. I don't even know how we're measuring it anymore. But people can flip out on you so quickly now. Mm-hmm. And so I'm staring and looking at this thing, and I'm clicking through, and I'm trying to figure out what the heck is the lion connection. Is this guy named Lion? Is he working for a zoo? What the heck is it? And the more I explored, and I put in about 20 minutes, he had absolutely nothing to do with lions. He was some sort of attorney. His name didn't relate to it. He just thought it looked cute. And so I put up my response of like 2 or 3 points